When most people hear the term dry eye, they assume it's one disease. They think their eyes don't make enough tears. And I think that that's a fair assumption because most of the time people are told just to use artificial tears. So it makes sense if you don't make enough tears, just replace them. And well, that's a myth. And that's why I don't love the term dry eye. Because in my opinion, it really oversimplifies what's actually happening. A more accurate way to think about this condition is ocular surface disease. The tear film actually has 3 layers. There's a watery layer or an aqueous layer. There's a mucus layer, and that mucus layer helps to spread tears evenly over the surface of the eye. And then there's an oil layer. That oil layer slows evaporation. And that means it's really a problem involving the entire surface of the eye, not just tear production. For most dry eye patients, it's the oil layer that's not working properly. And while some patients don't make enough tears, the vast majority of patients I see have problems with the oil layer of their tear film. And this means their tears evaporate too quickly. The oil comes from small oil glands in the eyelids that are called Meibomian glands. In an ideal world, every time you blink, your upper eyelid should meet the lower eyelid, and there should be a small, imperceptible squeeze that releases translucent oil onto the surface of your eye. And that oil is really important. It coats the surface of your eye, and essentially it keeps your tear film from evaporating too quickly. The problem is we don't always blink as we should, particularly in our modern world. As people spend more time on digital devices, we blink less, we blink partially, and then the muscle responsible for blinking, which is called the orbicularis, it weakens just like any other muscle that you don't use enough. And then our glands become plugged, or the oil becomes cloudy. And then our eyes, they don't feel good. They feel irritated, they burn, they get red, and often by the end of the day, they just feel really fatigued, particularly if you spent all day on a computer, which that's a lot of my patients these days. This will eventually lead to a cycle of inflammation, and now we know that treating inflammation actually increases tear production. And this is why so many patients tell me, I use artificial tears all day long and they barely help. If that's been your experience, you're not doing anything wrong. The underlying issue just hasn't been addressed yet. When we call this condition dry eye, it often leads to ineffective treatments. It minimizes the problem. It sets patients up for frustration and failure. Ocular surface disease is chronic. It's multifactorial, and it requires a layered approach to treatment. The words we use in medicine matter. When we oversimplify a condition, we oversimplify the treatment. For many patients, understanding that dry eye is really a problem with tear film stability, inflammation, and oil gland dysfunction, it helps them to understand the root cause of the problem and why a different approach to treatment is needed. In the next video, I'll walk you through how I actually diagnose dry eye, why exams can look normal even when people feel terrible, and what a thorough evaluation really involves. Understanding the problem is the first step towards getting meaningful relief.